Hi, everybody. Thank you so much for joining us today. My name is Michelle Morris, and I am with Consolidated Planning Group. Thank you so much for being here with us. A couple of housekeeping items before we get started. Yes, we do record all of these webinars, and you will receive a link later on today in your email that will have a link to the recording, but you'll also get the slides that we go through today. So you'll be getting this email at whatever email address you put in when you registered for this webinar. Now, if you happen to be watching on our YouTube channel or maybe listening on our podcast and you would like a copy of the slides, all you have to do is email contact@cpgcares.net, and we would be happy to send you over the slides for the webinar. Now, the other thing I want you to know is that because we're on Zoom in webinar mode, I cannot hear or see any of the participants. I know that you're out there. I see the little counter of how many people are watching, but you're muted and your cameras are off. So if you have any questions, please put them in the chat box. That's the easiest way for us to present the information and be able to watch for your questions. Um, we won't unmute anybody or anything like that. And since we can't see you, that gives you an opportunity to enjoy your lunch as you watch the webinar. So, a little bit about me and Consolidated Planning Group before we turn everything over to Miss Lynsy. Consolidated Planning Group, we are a financial planning firm, first and foremost, but we work almost exclusively with clients who have an individual in their life who have some kind of intellectual or developmental disability. So we've been in business for about 30 years, and we do things like life insurance, investments, retirement planning. But the thing that makes us different is that we understand all the nuances of special needs planning as well. And most financial advisors just don't get that part of things. We have taken the time to truly become experts by joining the Special Needs Planning Academy. We are nationally certified Social Security advisors and chartered special needs consultants. We are located just outside of Houston, Texas, in Sugar Land, but we work all across Texas and all across the United States. So we are truly here to help you and get your questions answered. So when we're thinking about special needs planning and what is that exactly? Well, just to give you some ideas, families come to us for things like protection plans. What happens if you, as the caregiver, or, what if the main breadwinner of your family passes away? And if that's both you, what would your family do without you? We can help look out for risks like that and help protect you against those risks. What about the lifetime care of your child? Once you are gone, most financial advisors plan to their clients passing, right? We get you through retirement, and when you die, that's it. With Consolidated Planning Group, we plan for you until the end of your child's life because they're going to need ongoing care, and you need to set that money aside before they pass away to be able to make sure they're taken care of. We do a lot with transition planning. We can help you understand ABLE accounts and special needs trusts and how the money needs to flow in the accounts to make sure that you don't jeopardize your child's benefits. And of course, we're here to advocate for you and to educate you about all of these topics so that, going forward, you can sleep a little easier at night knowing that you're on top of it. And let me just say, as a mom, I want to commend all of you for being here today because by seeking out education and information, you are taking that step in protecting your family. And whether you've got planning on the horizon, or maybe you've done some planning already, or maybe you're just trying to learn, it doesn't matter. You are taking positive steps for your family, and that Just by doing that, you're ahead of the game. I really appreciate you. And I'm sure your loved ones do too. Now, out of the entire United States, there are over 600, no, 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 263,000, sorry, 263,000 financial advisors across the United States. But out of those 263,000, fewer than 200 financial planning firms actually understand special needs planning. It's less than 0.1%. So you're truly with the right people when you come to us. So we think it's really important that you develop a future care plan as soon as possible. Start planning now, and that gives you a longer runway to make small changes that are going to have a large impact on your future. If you keep putting things off, you're not doing yourself any favors. Think about what's going to happen after high school. There are great educational and vocational options. There are fantastic residential community and transition programs. Some of these opportunities might have waiting lists. So double check, you don't want your child just to graduate from high school and spend the rest of their life on the couch playing video games. So look at what opportunities are available to them and just make very careful consideration before you say, hey, my child's sibling is just going to be their caregiver going forward. Well, if older sister Sarah and little brother Jacob have been best friends all this time and partners in crime, this change in dynamic can create some tension on both sides of that relationship. So just be really careful when you think that's going to be the plan. Okay. So, Lynsy, I don't want to take any more time from you. People are here today to hear about how Medicare and Medicaid dual eligibility can help them and how to maximize those benefits. So thank you, Lynsy, for being here with us today. She's from North Star Insurance Partners. She is a licensed Medicare advisor, and she's going to talk to us a little bit about how to maximize all of these benefits. Go ahead, Lynsy.
Well, thank you guys for being here with me. Thank you so much, Michelle and CPG, for hosting this and letting me come on and speak with you guys. As Michelle shared, I am a licensed Medicare advisor, and I specialize in helping the special needs community with their Medicare and Medicaid benefits and explaining Medicare Advantage. One of the things that make me maybe a little bit more unique than traditional Medicare advisors is that I worked in special needs facility for a lot of years. So 15 years or so, I worked as either a caseworker, an admin, a director in an HCS special needs provider organization. And I've actually done some presentations about the HCS program for CPG in the past. Somewhere along the way, it became very clear that even with large providers of care, we're just not fully understanding what benefits are out there for people. So I learned about Medicare. I've gone through all of the training, and now I've partnered with that HCS provider organization to help with benefits, but I also am helping some other agencies as well. And then, of course, families and others in my community. So I've been really blessed with the opportunity to talk to so many people and share this information. And not only am I going to talk about the great things about Medicare Advantage, I am going to be optimistic and realistic that there are pros and cons to everything. And we're going to talk about all of those things together. So our roadmap for today is what does dual eligible mean? How do I qualify? We'll talk about Medicare, Medicaid, and extra help. We'll talk about traditional Medicare versus Medicare Advantage, the extra benefits you get with Medicare Advantage, and then just kind of thinking about, what steps would I take to find out if Medicare Advantage is right for me?
Thank you so much. And I just do want to remind everybody, we received some questions ahead of time, and we're going to get to as many of your questions as we possibly can. So if you have questions that you've already sent in, we've got that list. If you want to ask a question, just go ahead and put it in the chat.
So what is dual eligibility? It is simply that I have Medicare and I have Medicaid. There is an example of the cards on the screen. The Medicare card is traditionally known as your red, white, and blue card, and your Medicaid, traditional Medicaid says your Texas benefits. It'll say the program that you're part of. If you have a managed care Medicaid, it will say the company name like United Healthcare or Molina. We'll talk about that a little bit. But basically, if you have both of these, you qualify for what's called a Medicare Advantage Dual Special Needs Plan, which adds some extra benefits to your toolkit. So if you've joined us today and you do not have Medicare, I just wanted to include this slide. I actually watched a presentation that Michelle gave about Medicare specifically and Social Security benefits. So I'm going to give you a little shout out that is a wonderful presentation to go on YouTube and look up for specific
Thank
things.
you.
Yes, but basically there's 4 ways to qualify for Medicare. You turn 65, you have Lou Gehrig or diagnosis of Lou Gehrig's disease, you have end-stage renal disease, meaning you need dialysis, or you have SSDI, Social Security Disability Income, for 2 years, and then you qualify for Medicare. So many individuals with intellectual disabilities qualify for Medicare on their parents' record as what's called a DAC, a disabled adult child. And I put on the screen here, you can see in order to qualify to be a disabled adult child, you have to be diagnosed in your physician notes with a disability before age 22. You have to meet the definition of a disability for adults, and you have to be unmarried. And there are a few other things, like say if you're a disabled adult child and you choose to marry another disabled adult child, that can be an exception, but you have to be really careful to get those benefits. And then, of course, once you get that disabled adult child um, title, sorry, you get your Social Security disability, and then your Medicare comes 2 years later. So that means your parent retires and claims their Social Security. Your parent is disabled themselves, or unfortunately, your parent is deceased. So that kind of gives you a little bit of an idea of how to qualify for Medicare as a special needs individual.
Now, typically, people, when they turn 18, they qualify for their SSI benefit, and that comes along with Medicaid. So once you get that kind of locked in, then later on down the road, when the parent does turn on their own Social Security for whatever reason, that's when their child can switch from SSI to the SSDI benefit. Now, they'll switch from SSI to SSDI, but they keep the Medicaid and then get Medicare. And that's the dual eligibility part that we're talking about.
Yes. So that's exactly what I was going to mention for Medicaid. So I always like to make sure that I share with folks exactly what Michelle says. Don't assume that your disabled child that turns 18 will not qualify for Medicaid because your family has too high of an income. It can sometimes be a little bit confusing, but when a special needs child turns 18, you apply them for Medicaid and get your Social Security income, and then the process continues. Now, I did put on the screen, and this is a lot to share. I'm not going to read this to you, but I just wanted to note some of the Medicaid levels. So if you become QMB Plus, a qualified Medicare beneficiary, that is the highest level of Medicaid, which qualifies you for the highest level of Medicare. It's part of the Medicare Savings Program. So getting that QMB Plus status, the SLMB specified low income Medicare beneficiary. I usually just say the acronym, so I'm like, oh gosh, how can I say the full on word? But SLMB plus and QMB plus, those are things that we look at when we're looking at your Medicare dual eligibility plan to see which ones you qualify for. Now, even if you just have QI, which is qualifying individual, it's going to cover your Medicare premium, Part B premium, and it will still sometimes put you into that position to qualify for a dual special needs plan, even with that lower minimal level of Medicaid. So it's something definitely to look at. Never just consider, oh, I don't think I qualify for that because I don't have full Medicaid. They make plans out there tailored to any level of Medicaid, trying to just help people maximize their benefits. Another program that's part of Medicare is called Extra Help, and this focuses on prescription drug coverage. So if you qualify for Medicaid, typically you get your Extra Help automatically. And then I also will help apply people in the community for Extra Help if they don't have it and they don't qualify for Medicaid, but they still meet the Extra Help income level. So with Extra Help, we're looking at people who are dual eligible. So we're assuming we have Extra Help. It's going to pay that prescription drug premium as long as you choose what's called a benchmark plan. And the 2025 premium for a benchmark plan this year is $18.30. So you can't go with the $60 Medicare prescription drug plan because it's not going to subsidize that completely. But there are some out there that do meet that $18.30 threshold where you can get prescription drug coverage at no out-of-pocket cost. It also then waives your prescription drug deductible if there's one included in the plan, and it reduces out-of-pocket costs for prescription drugs. So if you have full Medicaid, you're likely not paying anything for prescription drugs. But if you have partial Medicaid, it does reduce your prescription drug out-of-pocket cost to where you don't pay any more than $4.90 for generic drugs or $12.15 for brand name drugs. And those are, of course, the 2025 quotes. So it's likely going to change a little bit since everything goes up every year. And we're almost at 2026.
Almost at 2026
Almost.
already. Oh
Going
my
so
goodness.
fast.
Lynsy, how do people find out on this previous? I'm going to go back one slide, the
Okay.
Medicaid level. How do people figure out what their Medicaid level is? Is that like in a letter they get or?
Yes. So there is a letter that comes out. I actually keep a little sample. I should have put that in the slideshow. So reach out to me if you're curious. On your Medicaid card, many times your Medicaid level is right there in the top right corner. Also, you'll get a letter that says what your Medicaid level is. We can also call 211 together and we can ask what your level is. There's lots of different ways to find that out, and I'm happy to help. We have a system where we can put in a Medicaid number or a Social Security number and be able to pop that up as well if you have Medicare and Medicaid, because I have to put in your Medicare first. That's what then makes it say, okay, well, you're someone who should be looking at this, and then it'll let me bring up your Medicaid to see what plans you qualify for. So there's a few different ways to find that out. So I'm happy to help with that. Great question.
Thank you so much, Lynsy.
Yes, ma'am. So why consider Medicare Advantage? So when somebody qualifies for Medicare, and I think this was a question in the chat, usually if you have Medicaid, the Center for Medicare Services, Medicare and Medicaid, they just pop you into a prescription drug plan automatically. They just send it straight to you. You don't have to make any decisions. And they leave you in traditional Medicare. Your Medicaid then becomes your secondary, your traditional Medicare is your primary, and then you have your prescription drug plan. And that is a great coverage. A lot of people stick with that. And there's absolutely nothing wrong with that. Different plans work for different people. But I think it's really important to make that choice yourself and not have CMS decide what plan is best for you. Because if you have Medicare Advantage and it works for you, and we determine that not only are you getting your medical benefits, your prescription drug coverage, You're also, and there's no premium typically for these plans either, so it's not costing you anything, but it is adding in coverage for dental, for eyewear, for hearing aids, for healthy foods, over the counter medicines or vitamins. It usually provides some transportation assistance to and from doctor appointments. There's a fitness benefit that you can get a free gym membership or some online fitness classes. And usually they also provide some meals following hospitalization just to make sure that you get nutrition. So it's some really great benefits to consider because those are not part of the traditional Medicare and Medicaid program.
So you're going to dig into this Advantage program?
Yes, so I have a
Oh,
slide that highlights all of those extra benefits just a little bit.
uh-huh.
Now, where I say I'll always talk about pros and cons, I do want to bring this up because Medicare Advantage sometimes does get said, oh, it's Medicare Disadvantage. Different people believe different things. And it truly is about education. Not every program of anything works for everybody. So we do have to look at it closely. And I always pride myself in being very upfront and honest. If we look at it and it's not the best decision for you, that's okay. It's good to just have looked and know that you're making the best decision. But the things to know about Medicare Advantage also is that it works really wonderfully for a ton of people, and they're super satisfied and never run into one problem over the years of using it. So it can be really amazing. But the things to just know for sure before you look into it is that with a dual special needs plan, it is going to require you to choose a primary care physician. It is going to require you to be part of a network of doctors, specialists, imaging centers, hospital system. It is going to require an in-network pharmacy, which most pharmacies really are in-network. All of the major name brand stores pretty much are. It's just a few mom and pops that aren't possibly included, but for the most part, pharmacy coverage is really widely available. Um, and it may require referrals and prior authorizations for certain medical services or prescription drugs. There actually are now some plans with Medicare Advantage, even though they are HMO or dual special needs plans are typically HMO, that don't require referrals because they're trying to open that up and make sure people are getting the benefits and the access that they need. And then, of course, you have to live in a certain plan area to qualify for that plan, and that's based on your county. I also wanted to note, and I put on the slide, that if you have Star Plus Managed Care Medicaid, these are the exact same requirements that you're already used to. So it's really not too far off from that. It's just if you're on the traditional Medicare and Medicaid, it will look just a little bit different, but not a whole lot different because most specialists like a referral no matter what, whether the insurance is a regular employer plan like I have with my husband or through Medicare or Medicaid.
Now, we're getting some questions, specific questions about, hey, we were on Medicaid and then they switched us over to Medicare and he has to pay for medications when he didn't have to before. Do you want those specific questions now, or do you want to wait until the end for some like that?
Um, I think, can we wait till the end? Is that okay? Because there's
Yes.
some of that is going to be a case by case basis, and we may be able to like set up an appointment and look at that specifically for the situation because I don't think there's going to be a rounded answer for why that occurred. It's going to be
Okay.
based on Medicaid level, whether or not maybe the extra help dropped off. It to me, if that happened, it's going to be specifically something to look at.
Okay. Okay. Yeah, we'll get to those questions. There's two of them in the chat box right now. We'll get to those a little bit later.
Okay. So I also want to highlight that you also have to be aware, and I'm not saying beware like scary on either of these things, but just be aware that traditional Medicare alone, the red, white, and blue card alone, is very, very expensive. So one of the things that we do as Medicare advisors is make sure that you understand that with any traditional Medicare, you're going to want some sort of supplement. So if you don't have Medicaid, you may look at a Medigap policy, which is a whole different topic for another day. But for our purposes, we have Medicare and Medicaid, and we want to make sure that we're covered. But so many people that have Medicare and Medicaid may be in the process of reapplying because possibly you were part of that huge million-person Medicaid unwinding that occurred in the last couple of years. I'm working with some special needs provider programs right now that are still dealing with the after effects of that. And they have so many people who are still not back on their Medicaid when they qualify for it. And it's very, very frustrating. So when that Medicaid falls off, you only then have traditional Medicare. So these are things to really be aware of. If you go into the hospital on traditional Medicare for 2025, there is a Part A deductible of $1,676 that you meet. And then you pay 20% of your stay. If you go to the doctor, you pay 20% of your copay, which isn't, or sorry, your total visit, which isn't probably much more than a regular copay. But if you go into the hospital or you have something major come up, that's where you have to really worry. So it's not that uncommon to, stay in the hospital for a few days and get $20,000 worth of bill. We've all seen the explanation of benefits where it's like, oh, okay, I went there and it was $1,800 or $2,000 and you really don't feel like you really got anything done. Man, if you have to be admitted in the hospital and get a bunch of lab work and maybe see, several specialties and they're doing a lot of things, that can add up really fast. So here's just a couple of examples. So if you stay in the hospital and the bill is $20,000, your copay that you're going to get in the mail, your bill would be around $5,676. Say it was something really, really urgent, like say you had a heart attack and had some real major stuff going on. God forbid, we don't wish that on anybody, but it happens and you've lost your Medicaid. You're in that phase of trying to get it back. If that stay is $100,000, you're paying over $20,000. So we just have to be really vigilant on what traditional Medicare means. So what I've done for some of the special needs providers that I'm helping is while they're without the Medicaid, we're going ahead and looking at Medicare Advantage because things that come with Medicare Advantage is a no-cost primary care visits typically. And I'm talking in general, typical. I can't talk about any specific plan because plans vary by county, plans vary by company. But just in general, most have, you can see your primary care physician for no cost. You're going to pay a copay for the specialist. You're going to pay copay for or co-insurance for any testing or any work that you're done. But the most important thing is there is a maximum out of pocket, just like typical employer coverage, where your maximum out of pocket might be $4,000 or $6,000, and then it's paid 100% after that. Medicare Advantage does have that limit included where you don't have to worry once you get to that amount, even though that's still high, a lot to pay. At least there is a ceiling on the amount you would pay. So now we're going to talk about the extra benefits a little bit closer. And I get really excited about this. And, it is true. We are so, glad to have our Medicare and Medicaid. We're happy to have the health insurance benefits because at the end of the day, it is a health plan. But when you can add to your health plan all of these extra things that maybe you don't have, it can make a big difference in your life. So if I'm talking just in generalities, there again, I'm just making a little summary of what you may see in a Medicare Advantage plan. So dental could be between $2,000, $3,000 typically, up to $5,000 of dental coverage. And that's covering your preventative care, and that's covering some comprehensive care. And that can go a very long way. So I know if you are, someone whose loved one is in a program like the HCS program where you have $2,000 a year to pay for dental, or Texas Home Living, you have $1,000 a year to pay for dental. That's great. It is so wonderful, but it's not enough if you need a root canal, so this is getting you that coverage that goes just a little bit farther. With vision, Medicare doesn't cover a vision appointment, which I think is a little unusual, but it is the case. So it's covering your vision appointment, and it's also covering usually around $300 to go for some glasses, a pair of glasses. There's a hearing benefit. I would say, around $2,000 to help cover the cost of a hearing aid. There's healthy food and over-the-counter item benefit. And one plan this year is offering $181 for 2025 to help with healthy foods and over-the-counter items. And really, with inflation and the cost of just what things are in general, that has been a huge game changer for some families. It's been a relief. I've just worked with some people that are very grateful that the extra benefit is there to help cover foods. And when we're talking about healthy foods, how I describe this is if you walk around the outside of your grocery store, not the inner aisles, but the outside area. And it's so funny because I got this explained to me this way one time, and I was like, it really is true. Your healthy stuff is on the outside, and all the aisles in the middle is all of the, probably the stuff that tastes the best, but it's your fruits, your vegetables, your meats, your milk, your cheese, all the different dairy things. But then pleasantly surprised, it does cover, some mac and cheese cups and some coffee and some juices and canned fruits and vegetables. Mac and cheese, well, I said mac and cheese. Let's see. A lot of people like pudding cups and applesauce cups. So it does cover a wide array of things. Some are not as healthy as others, but for the most part, we're looking at the healthy stuff on the outside of the store. And then when I'm
Since
talking,
you're
oh,
yeah,
go ahead.
since you're on that, before you go away from the healthy foods and over-the-counter items, do you need to let SNAP know? Or is this in addition to SNAP if you're on SNAP benefits?
So how, and I'm not 100% sure if I'm right, but this is how I look at it. So, take it for what it is. This is an extra benefit of the Medicare program that you choose. This is not an income related benefit. So the way I look at it, and I believe that it's correct, is that you're choosing this Medicare plan. This is a perk of the plan. So I would not think this would be something that would be reportable because it's not income based or related. It's just a perk of the plan. And the perk could change at any time. They can take that away. Typically they don't, but it's not a guarantee. Is that
Okay.
fair, Michelle?
Yeah, I would say so. Thank you very much on that one.
Okay. And then just talking a little bit about over the counter, if you're not sure what that means. Over the counter is like your vitamins, it's your tummy medicine, your headache medicine, your allergy medicine, all of those kind of things. But it does include some incontinence supplies. It can include some of the like Ensure protein drinks. A lot of people sometimes require. So there's a whole ton of things that you can get with that. And I've got some catalogs and things to share on ideas of how it works. And Walmart and Walgreens are two of the places I recommend the most to go to get those items because they make it really easy to use the cards. For the transportation assistance, usually you're getting maybe about 12 round trips per year, so about once a month. It'll help you get to and from a pharmacy, a doctor appointment, a dentist appointment. So there are sometimes several more trips. I'm just kind of giving an average. Some plans even have unlimited trips. It just kind of depends. But that's really nice because in our case, you would say, well, I can't put my loved one on this, bus by themselves. It is okay to have an escort. So that's really nice. So say a good example is, you're going to take your loved one to a dentist appointment and they're going to be sedated. and you want to be able to watch them on the ride home. I get that one a lot. Well, it's hard to be able to watch them and get a good eye on them while I'm having to drive. Well, this would be an opportunity to use that transportation. And usually it's about 50 miles or so you can go with that benefit. And then I kind of touched on the gym membership before. All of the major gyms. I live in a small town. Our local gym takes the plans. You might have heard of Silver and Fit or Silver Sneakers. That's exactly what this is. And most gyms want to work with those plans. And then, of course, the online fitness benefit, if that's not something you're interested in, but you'd still like to get maybe a fitness video or um, uh, some education on fitness in that direction. And then the meals following hospitalization is really kind of cool. I describe this sometimes as, just a easy way to have an extra meal in the freezer for a day that you don't want to cook. So, a lot of people, well, I don't really need that. Yeah, but get them anyway, get them
Why
anyway. And then
not?
one day you might need that, and you might find one of them is really tasty. I think a lot of them go through like mom's meals and things. So you might find one or two that are really tasty and you got them. And why not have at least a free meal in the freezer? You could, if worst case scenario, you can always give it away to someone in need. So I wanted to do a little bit of a dental highlight, and I kind of went into it. I get excited about dental. A lot of people I talk to need that dental benefit. So I kind of went into it on the last slide, but what can $3,000 of dental do for your loved one? So I worked in a group home facility for a long time, and we worked with a lot of individuals who were nonverbal. And, people sometimes have some pretty tough behaviors. And we learned on more than one occasion that it's dental pain. It's some sort of medical pain. Not every challenging behavior is due to being a challenging person. Sometimes it's just because you need that dental health, you need that medical appointment. You just have to figure out what is wrong and improve that person's life. And so many people go without dental because it's just a back burner sort of thing. So I've got a couple of fun facts that I wanted to bring into the presentation that I learned in a dental presentation a couple of years ago. One is that did you know that having your teeth clean lowers your cholesterol because the little buildup that goes on your teeth is actually the same thing that cholesterol is. So getting your teeth clean can lower your cholesterol. I thought, oh, well, that's interesting. Another thing is inflammation in your mouth can cause high blood pressure because the increased pressure in your gums will cause high blood pressure. So I'm like, okay, this is why they say that poor dental hygiene can lead to heart issues down the road. So anyways, we all know dental is important. A lot of people put it off. Another reason that people put dental off is environmental reasons. I'm just scared to go to the dentist. A lot of
Me
our
too.
I know. A lot of our community, especially our special needs community, they don't like the dentist. It's scary. So I work in partnership with Enable Dental, and I just want to give them just a little bit of a shout out while we're on this. In case you haven't heard of Enable Dental, they've also done a presentation for CPG that you can find on their YouTube channel, a little bit more about them. But they accept all United Healthcare Medicare Advantage plans, and they're working to accept even more dental plans. So they are a very, um, I don't know, just a really great option to consider if you're looking for a dentist that will come to you. So they work with those environmental factors. So if your loved one is scared to go to the dentist, they actually work with families to bring the dental to your door. So they go to different group homes, they go to different day facilities, they work, like I said, with families. And then of course they go into nursing homes and all kinds of different places, but they bring the dental to your door and take out some of those environmental fears. And then they'll also work with you if your loved one is typically sedated for dental. They have been really successful in, since they're coming to you and taking away some of that anxiety, helping someone not have to be IV sedated to get their dental care. So I just wanted to give them a little shout out on this. I put Lynn Clauser's information on the screen. Her title is Community Relations Manager, and she does work to see, where their services would benefit the community. So this is a question probably in the chat. Well, if I have a waiver, how does this work? So
Well,
waiver
and
service.
when you're going through this, if you wouldn't mind, how does it work even with private insurance? And people are asking that too, what order do things get paid in and how does these plans work with private insurance?
Well, okay, so Medicare typically goes first before even private insurance. So I would say your Medicare Advantage would go first and then your private insurance, and then Medicaid is going to be the payer of last resort. So if you combine your Medicare and Medicaid, I guess I'm trying to think on that question, why would you have Medicare and Medicaid and private insurance? Because if you had dual coverage, like you're really well covered. I think we'd have to kind of talk
Then we
about,
can drop it off maybe.
yeah, that's a lot. That's a lot of coverage. Unless you're getting the private insurance, like if you're just like all your kids are covered, why not have it? But if you have Medicare, Medicare typically is first to pay, and then private insurance would be second to pay, and Medicaid is payer of last resort. So that would be the order I would think. So if you chose Medicare Advantage because you had Medicare and Medicaid, I would say Medicare Advantage is going to pay first. I'm repeating myself now because I'm thinking it out in my mind, but
Yes. I
that's
think
that's
people are
how
talking about, if their disabled child maybe is able to stay on mom and dad's work
for free. Yeah, yeah.
insurance or something like that. Yeah.
Yeah. But if you qualify, you're allowed to have this and that. Like there is no rule that says once you qualify for Medicare, you can choose any Medicare plan you like. So you can be on the HCS waiver and choose any Medicare plan you like. You can live in an ICF, an intermediate care facility, and choose the Medicare plan. Waiver is attached to Medicaid and Medicare is its own thing. So it will not affect any of those other services or benefits. And I know this because I do it. I've been working for a long time with these programs and I've never seen a negative adverse effect. So I'm not just saying it, you guys, I see it every day. We have so many people that have all different kinds of ways to put the programs together to maximize the benefits that just meets their needs the best. So let's talk just a little bit about managed care Medicaid. This is being, kind of pushed in. You might be a family who thought they had traditional Medicaid, and then, okay, here comes this packet automatically from CMS that says you are now on United Healthcare Managed Care Medicaid or Molina or WellPoint or whatever that may be. And as I had kind of touched on before, it just means that you are now in a network of doctors that takes that particular plan instead of traditional Medicaid, which is fee for service. But one thing I want to say about Medicaid is over time, what is happening is that the rates are dropping for what the state wants to pay for Medicaid. Medicaid dental rates are at their all-time lowest. The reimbursement to the doctors it just keeps getting negotiated down. Managed care Medicaid is, I think it's the state's attempt to try to rectify some of it. But I guess where I'm trying to get to with saying too many words is doctors are just not wanting to take Medicaid like they used to. It's a little harder to work with. the managed care is not always fruitful for them. So, and this is another way that we have worked together with group home providers to improve benefits. I've worked with ones that say, well, I can't find a cardiologist, I can't find a rheumatologist, I can't find a neurologist that'll take Medicaid. And this is even sometimes in the traditional Medicaid space, not just managed care Medicaid. And Medicare Advantage will pay a little, I mean, it's not the highest rate, but it does pay a little bit higher rate than Medicaid does, which makes them more widely accepted. So I guess that's the point I'm trying to get to with all of that said.
Yes.
Um, it is helpful. And there is a program out there called Star Plus. I did see this comment in the chat. So if you don't have an HCS slot that helps you cover like attendant care and day services and minor home modifications, if you are not qualifying for one of those, you can look into Star Plus Medicaid. And Star Plus has those services built in where you can get them through Medicaid. So it really is kind of a nice opportunity. And there again, you can have your Star Plus attendant care services and your Medicare Advantage plan all working together to benefit you the most. So that's another way programs kind of come together and help people. The state has really pushed to match Medicare and Medicaid together. They are calling it fully integrated dual eligible FIDE. And in 2025, they came out with a new Medicare special enrollment program that says you can enroll in a FIDE plan at any time of the year. And what that basically means is we'll just say like you have United Healthcare Medicare Advantage and you have United Healthcare a Star Plus Medicaid. So since you have United Healthcare for them both, or WellPoint for them both, or Molina for them both, you are now fully integrated. And being fully integrated does improve your healthcare. They're looking at you across the board. They're processing claims. You're likely to have less, questions and denials and things like that because they're really looking at you as a whole. So the goal for integration, what they're trying to get to, really is a nice thing. So just keep that in mind. That's what the state is aiming for is improved healthcare and a more person-centered
Comprehensive.
approach. A person-centered and comprehensive approach. Thank you.
Yes.
So with all of those things said, this is the slide that it comes down to. Is this right for me? Well, this is where I would love to set up a meeting and talk to you because I can't say, however many people are on here, this is right for every one of you. It may or may not be. And I do not push, I just educate. So the first thing that we do when I sit down with anyone is we check your eligibility. So we're going to pull up your Medicare. We know it's active. We're going to pull up your Medicaid. We know your level. We know which plans you qualify for. Then we're going to check your network. So everybody pretty much has established doctors that they want to see, a primary care doctor. Maybe there's a certain eye doctor, certain specialists that are non-negotiables. These are the folks that I have to have in my life to take care of me. And that is perfectly great. But I don't just access, a website and type in the doctor's name and it says they are in it. That does not work, you guys. They don't keep those systems updated the way that they should. And I've had it happen before that it says they are and they're not because things do change. So be really careful on looking up doctors on websites. You may already know that from experience. So I actually pick up the phone and call every single doctor. So it can be a little bit of a process, but it is in my opinion, the right thing to do. So I call and I ask, do you take this plan? We're looking at one or two plans. Do you take this plan that you're interested in? Then we look at your medications. Are your medications covered on this plan's formulary? Then we're going to compare your plan options. So now we have it down to, maybe two. We're going to talk about those plans. We're going to make sure that you are comfortable with the benefits and it's the right thing for you. And then at that point, we'll make an enrollment decision. So that's kind of how I like to run, my meetings whenever I meet with someone, and we really go through it and look at everything. And
Yeah.
then if you're still wondering, like, well, why would this be for me? Well, I'll toot my own horn just for one little second and say, because then you have me. And, you know,
Exactly.
and continued support, and I say that jokingly, but if you've ever signed up for anything and you have somebody fill out an application and then you just, forget about me, you signed up, we're all done. Um, I'm not that way. I believe in continued support. So once I tell every client that I help with an application, okay, now we're in this together. So if you get a bill that's unexpected, if you get a denial that's, obviously denial's unexpected. Uh, if you need help finding a doctor, if you're not sure how to use that grocery card, call me. These are things that a Medicare advisor, once we enroll you in a plan, we are supposed to provide ongoing support. And I value that. I value getting to know people, and comparing one experience to another can answer questions for other people, and we learn together. I don't always know the answer, but I promise if I say I'm going to get you an answer, I will. So basically that's what I do for anybody that I help.
Do you offer kind of concierge services like we do as well? So here's how you can get in touch with Lynsy, the phone number, the email. Can you
Yes.
tell us about the enrollment period?
Yes. So you can call, you can text, you can email. Um, I will, if I can't answer at that moment, I will get back to you. I will share that this is a great time to have this presentation because Medicare open enrollment Medicare annual enrollment is called AEP, annual enrollment period, and it's right around the corner. So it's October 15th through December 7th of every year. And that is where you can make the choice to enroll in any plan that you want. So it's a great time to set an appointment and just kind of talk about if this is right for you. Because if we decide to do an application, any application completed between October 15th and December 7th becomes active on January of 2026. So it starts the first of the year.
Fantastic. Thank you so much, Lynsy. I'm gonna go through a couple of slides and then we're gonna get to the rest of these questions.
Okay.
You know, we at Consolidated Planning Group, we provide these ongoing kind of educational webinars 2 or 3 times a week to try to make sure we are helping families as much as possible. I did see a question in the chat box. What is a waiver? Well, the Texas Medicaid waivers, the Texas waiver program, these are, you might have heard of the waiting list instead of the waiver program. This is that long 17 to 20-year long waiting list where you sign up for these additional supports and services. And it's just because there's not very much funding here in Texas. Some states don't have this long wait for their state waiver programs, but they can help waive off some of the costs of some of these supports. They also kind of waive off some of the rules surrounding Medicaid and get you these services, whether or not you qualify for them in other ways. But they can again help you pay for transportation and dental and housing and prescriptions and therapies and all of those kinds of things. We've done complete webinars about the waiver programs. We also talk a lot about, future cost of care estimates, planning for the future, um, the difference between different benefits like SSI and SSDI, thinking about ABLE accounts, your special needs trust, all of these different kinds of things that you need to keep on your radar when it comes to planning for your loved one's future. Now, I mentioned that you will receive these slides later today, and this one is just a link to our upcoming webinars. You can register for those once you look and see what is on the schedule. And then that way you'll get a reminder email and you'll get the slides after that webinar has been done. Now, at Consolidated Planning Group, we offer a completely free Zoom consultation. This is usually about 30 to 45 minutes where we answer any questions that you might have left over from today's webinar, or just any questions in general about special needs planning. And then we're going to talk to you about, what we advise. We have you fill out a short questionnaire, and we use that to be able to look for areas where we can give you some advice and learn about your family. And then we would tell you, what we think we might be able to do for you, how we work, what our services look like. I would encourage all of you to go ahead and sign up for your free Zoom consultation just to learn more about Consolidated Planning Group and see if it would be a good idea for you to go forward working with us, whether with one of our free options or one of our paid plans. We do offer a lot. You can use the QR code or call or email the office for that information, or you can call or email me directly. My information is in the chat box and I can sign you up for that meeting. There's also our YouTube channel, Facebook, Instagram, and our podcast links down there at the bottom of the page for you. And finally, this is our whole team at Consolidated Planning Group. While I am looking back for questions, I just want to let you know that we are a small group. We're independent and we work as a collaborative team on every single client we have. So you would never say, oh, Michelle Morris is my advisor. It's all four financial advisors are on your side. So you have the whole firm working for you. Okay, so I'm going to leave this page up so that you can all schedule your Zoom consult while we get to these last questions. So, Lynsy, someone says, I've heard that once you go on a Medicare Advantage plan, that's where you are. There's no changing it after that. Is that correct?
So you can make a change every single year. There are some other special election periods where we can make a change. If you have the waiver service, you can make a change at any time. If you do not, we usually have to find an election period. So it is kind of true that you are locked in to a certain degree. That's why we have to be so careful that we check all of the boxes before we do an enrollment, but you're not locked in forever. You can go back to traditional Medicare and Medicaid during the annual enrollment period every single year.
And so you said this case where they were on full Medicaid and then got on Medicare and now they have to pay for prescriptions. Do you think that was just a mistake that they got knocked off the prescription plan, or do they need to re-enroll or just get in touch with you and let you look at things? What should someone do in a situation like that where they have questions about why did we get knocked off of this or that, or what is happening?
You can call 211. You can call, what you might want to do, that what I would do if is possibly just do a new extra help application on Medicare.gov. You can click the extra help application. You can call me and we can do it together. It's about 10 minutes. I can tell you what all we need for documentation. There's a few different ways to try to get that answer, but finding out if it's something to do with your level of Medicaid, uh, you know, I'm just not 100% sure. That's not super common that in any of the instances that I've been part of.
So there's a question in the chat box about somebody who was um, knocked off of Medicaid because he was getting above the monthly SSI income level. Again, I think that's a personal situation that we would have to look into, why that would happen, because that should not have happened. And that could be another one of these anomalies. Unless we dig in a little bit and we see, what was that income that he was getting and how was it reported and what exact benefits was he on um, to cause issues like that. Okay. well care. So you explained kind of about getting assigned to where well care for the extra help.
Mhm.
And the family plan through the husband's employer is still in place. And that's what we were asking about. Who is the primary if they're getting the Advantage plan and some of the other benefits, but they do still have the family health insurance. I think it's more important, Lynsy, you can please correct me if I'm wrong. If they have a specific doctor that they absolutely want to stay with, like their son's neurologist, um, then it's best to stay with the group health insurance, or does Medicaid
Well,
and Medicare cover any doctor?
Well, so if you get into the Medicare Advantage, the dual special needs, it is going to be a network of doctors. So what I would say we would do is we would call that neurologist office or whatever the doctor, well, we would call all of the doctors and we would say they have this private health insurance and then they have this Medicare Advantage plan. How would that affect their visiting to you? And that office will tell us, oh, we don't take that, but we'll take this instead, but you'll have a copay of this. They'll be able to explain that specifically. But if the employer plan covers it and the doctor is in the Medicare Advantage network, there's nothing to worry about. Whether which one is primary or secondary won't even come into play because they're all covered.
Right. So do people need to reapply for Medicaid every year after they're on Med? So this person is saying when he went over to Medicare and dropped from Medicaid, they had to reapply for Medicaid. He got reapproved, but now they're saying he has to reapply for Medicaid every year now.
Yes. So my brother-in-law is actually a disabled adult child, a DAC, and so we just went through that exact process. So he went from he had Medicare and Medicaid, but then his dad retired. He got the DAC status, and they had never had to apply for Medicaid all of those years. And we had to redo the Medicaid application, and they've made it super clear that every single year when they send out that form, that they want the 3 months of income and they want the renewal form on an annual basis. So I have told my mother-in-law, I'll tell anybody, please just check your mail every day. If you're on any of these state programs, it is so important to check your mail and open any letters that you get because you never know when they might want additional information. You just really have to stay on top of it because the time frame of turning things in is really short as well. Another recommendation, I know this is answering your question and then some, but don't mail it back. Go find somewhere to fax it back, have your confirmation, and just get it to them as fast as you can. The mail system just isn't reliable enough these days to expect them to get it back in time.
Yeah. And then the last question, because I know we're over. Does the MSP QMB cover the shared costs that Medicaid does not cover, like a Medigap policy?
So Medicare Savings Plan QMB. So that's the highest level of Medicaid. So your Medicare and Medicaid, yeah, you shouldn't be getting any bills. If you're on Medicare Advantage, the plan that I would show you would have zeros throughout every single thing, pretty much all the way down the line, plus the extra benefits. There would be no out-of-pocket costs for any providers or any services.
Thank you. Thank you so much, Lynsy, for being here with us today, and for everybody who has participated and asked great questions.
Mhm.
Thank you for being here today. I really appreciate you all. I hope you have a great week and that you're able to get some helpful takeaways for yourself and your family today. And like I said, and like Lynsy said, if you have additional questions, maybe you didn't want to open up in front of a whole group, or maybe we just didn't get to you, or whatever, please schedule with one of us. If you want to talk specifically about this topic, maybe call Lynsy. If you have more general questions about special needs and financial planning, that would be me. And we are
Mhm.
truly here to help you. So Thank you all. Have a great day and a great week. We'll talk soon.
Thank y'all.